Hi, I'm Dr. Michael Lyons with Advanced Chiropractic and Rehab. I have a patient here, Sandy. I wanted Sandy to discuss with her some of the treatment we've provided with her and some of the success she's had in her office, along with some of the difficulties we've also had. Sandy, how long have you been a patient of ours? It's been a while.
At least 6 years,
About
probably.
six years now.
Yeah.
And can I ask you how you came to find us?
I had to go through 175 doctors,
Mm-hmm.
and they were given to me by workman's comp,
Mm-hmm.
but nobody would take me.
Nobody would take you.
No one would take me.
Mostly because of your pain management at the time.
Exactly.
And the pain medications that you were on,
Right,
correctly?
exactly.
Right. And then you ended up coming to see us, and I told you I'd take you as your physician of record, right? And going backwards here, you have a serious back injury, correct?
Right.
That you ended up hurting yourself at work, and you ended up having to have a back surgery, but you were left with permanent nerve damage in your leg, right?
Right.
And you've had a lot of complications with this, correct?
Yes.
And you didn't have a very successful outcome with back surgery.
No.
No. And you've had a lot of ongoing difficulty and pain, and now we have severe arthritis in your hips, correct?
Correct.
Okay. So you're permanently and totally disabled, correct?
Yes.
According to work comp?
Absolutely, yeah.
Okay.
According to my body, yes.
Right. And then you came to see us about 6 years, and tell me a little bit about some of the things that you felt really helped that we provided for you in our office.
I could get off of the major pain medications, the OxyContins and all of that, with the massage therapy and the stem, electrostim, and it just helped so very much that I could actually get off of the major pain medications that were killing me. I mean, and I was robbed twice for my medications.
Right. There was a lot of complications.
A lot of complications, yeah.
So for the first couple of years, we were fairly successful in being able to manage your pain medication.
Yes.
If I recall at the time, we were able to take you down from the heavier doses of the OxyContin, even though you were still under pain management. Didn't we go down to something like a tramadol or something like that?
Yes, that's what I was taking.
And we were able to reduce your overall morphine equivalency quite a bit with these alternative therapies, correct?
Right, exactly.
And
yes.
so, can you remember off the top of your head when the last time they've actually allowed any kind of therapy for you? It's been a couple years, huh?
Yeah, I was just going to say at least 2 years, maybe a year and a half to 2 years.
Even though we've provided some of that care for you, even when you were really bad, correct? And they've still denied it.
Yes.
Okay. And they have not allowed any other type of therapy or care for you?
No.
Okay.
Nothing, no.
Despite the fact that you're permanently disabled.
I should know what to do for myself. That is what they say. And I've never had a bad hip before, or I've never had any of this before, and now
when you were getting treatment, did you need a walker?
No. I was using a cane, but now I can't. I mean, I'm with this constantly.
Right.
And it's very debilitating for my mind and my body, because I can't do anything even in my house. I live alone, and I can't clean my house. I have animals to take care of. I have a yard to take care of. I live on 3.5 acres.
Right.
And I can't do anything. It has to be hired out, and that can't be paid for either.
Right. So they're not, but they have recently allowed more pain management, correct?
Oh, yeah.
So now they're paying for pain medications at this point.
Yeah.
So now, despite recommended treatment guidelines, which would include alternative therapies as opposed to opioid pain medication, so we've tried for close to 2 years to try and get alternative therapies such as chiropractic care, exercise therapy, massage therapy, dry needling allowed for you, all of which have been repeatedly denied by work comp, despite you being permanently, totally disabled with absolutely no chance of you returning to a normal life
No.
or returning to any kind of gainful employment, right?
No.
So they, right, and so they, but they will allow more opioid pain medication.
Yes.
And now they put you on this new pain medication that just came out, and they told you up front that it was an addictive pain medication.
It is an opiate.
It is another opiate.
It is another opiate. It's oh brother, I can't remember. It's Belbutra, something like that.
Mm-hmm. So they're allowing this,
yeah.
despite the fact that we were able to manage your pain with tramadol and massage therapy.
And it's, I don't like it because I need to be able to function for myself.
Right.
You know.
Well, this was the problem we had with it when you first came in.
Exactly. Yeah,
okay.
Exactly. And that took me away from all of that insanity. I mean, I'd had enough. Plus, I learned that it changes the pain receptors in your brain.
Yes, it does.
And if I would have to have another major surgery,
the pain medication might not be as effective.
Exactly. I might wake up in surgery. Hello.
Oh, that's not good.
No.
All right. Well, Sandy, hopefully we can continue to help you.
I hope so.
I know I keep fighting the fight.
You have been such a wonderful human being to me. First of all, not just a doctor, but you have really given me some strength to go on when I feel like some days that I always say, take me out back and shoot me, because
we'll always be here for you and help you.
I know.
Okay.
And I really do appreciate it.
Well, thank you, Sandy.
I really do.
All right. Thank you.
Thank you.
All right.